Susan Bowers is a 55-year-old female who was brought into the ER by her husband due to chest pain. Upon review of her symptoms, it is determined that she is experiencing an acute myocardial infarction. She underwent a cardiac catheterization procedure, which showed two-vessel coronary artery disease. The dietitian referral requests that an assessment be completed and a heart-healthy kosher diet be provided. For this assessment, looking at her past medical history, it shows that she has hypertension, hyperlipidemia, and osteoarthritis. She also exercises or walks 3 to 4 times a week and consumes 1 to 2 glasses of wine per week. She is also married with 2 children and 4 grandchildren. Her medications include metoprolol for her hypertension and atorvastatin for her hyperlipidemia. She also takes multivitamin daily and calcium and vitamin D. She is 64 inches tall and 173 pounds with a BMI of 29.7. Her labs showed a glucose level of 122, elevated lipids, and an abnormal ECG. For her food and nutrition history, it's important to note that she is Jewish but doesn't adhere to all traditions. However, she does try to eat kosher when possible. I believe that a 24-hour dietary recall would help to see what she's eating in a day and how much she's eating. For the nutrition diagnosis, the PES statement is hyperlipidemia related to excessive fat intake, as evidenced by elevated lipid levels and coronary artery disease. For the nutrition intervention to help manage her hyperlipidemia and hypertension, I would discuss implementing the DASH diet. This is naturally lower in sodium and provides proper amounts of fruits, vegetables, and whole grains. Due to the fact that she follows a kosher diet, I would make sure that any dietary recommendations honor that. Also, as a nutrition professional, I feel that I should become familiar with places that sell kosher products so that I could provide that information to her within the recommendation. For the infographic, I have from the American Heart Association, What is Cholesterol? This does a really good job of explaining the difference between blood cholesterol and dietary cholesterol. It also explains and breaks down the difference between bad cholesterol, good cholesterol, triglycerides. I think that a lot of people get confused between what good cholesterol is and what bad cholesterol is, and this does a good job of explaining that. For nutrition monitoring, I would want to follow up with her weekly to see how she is managing the changes and how effectively she's implementing those. I would also suggest that she monitors her blood pressure levels at least twice a day. And lastly, I would want to recheck her lipid levels in about 3 months to see if there is any improvement.